Let's talk about ARDS, or acute respiratory distress syndrome. Now with ARDS, basically there's an increase in permeability in the capillaries that surrounds the alveoli. So basically there would be a fluid buildup within the alveoli, okay? So you have to understand there's a fluid buildup in the alveoli. What occurs is due to this fluid buildup, it compromises the lungs' function of oxygenating the blood. So basically it results in low volume of O2 within the blood. So with ARDS, basically we have fluid buildup in the alveoli that compromises the lungs. Therefore, there's low levels of oxygen that is being pumped up into the blood. So who develops ARDS? Basically, it occurs more to patients who already have multiple risk factors. Now, when we say risk factors, we're talking about clients who, let's say, had a trauma or a lung injury, in which that patient developed pneumonia, due to the chest trauma or some kind of embolism or shock or sepsis in the system. Those patients are more at risk for having and developing ARDS. So how do we assess these patients? These patients would show symptoms of tachypnea and dyspnea, so basically they have rapid and difficulty breathing. They would also have refractory hypoxemia, which is low levels of oxygen in the blood. They would be tachycardic, right? They would have severe shortness of breath. They would be confused and they would have lethargy, and this is due to the low levels of O2 within the blood. So what can we do for these patients? Antibiotics and steroids may be given, but may be administered to fight the infection and minimize the inflammation. Diuretics can also be given to reduce, let's say, pulmonary edema with patients with later stages of ARDS. But the most important thing is that respiratory support is the most important thing. We give the patient oxygen, maybe through a tight-fitting mask and a CPAP, which is continuous positive airway pressure, right? May be given to the patient. And if the patient is really in severe respiratory distress, you might have to intubate the patient through endotracheal intubation, and then we mechanically ventilate the patient through PEEP, which is positive and expiratory pressure. PEEP helps by preventing atelectasis, which is also a collapse in the alveoli. Don't forget to place the patient in a comfortable position that maximizes air exchange, such as, let's say, a semi-Fowler's or a high Fowler's position. An easy way to remember the treatment and interventions to be done for a patient with ARDS is to remember ARDS. A for antibiotics, R for respiratory support, D for diuretics, and S is proper situational positioning of the patient, which is the high Fowler's position to maximize proper airway exchange.